Brain fog after 60 is one of those complaints that can be difficult to describe. You know something feels different, but you can't quite explain what it is. You walk into a room and forget why you went there. You read the same paragraph twice. You know someone's name, but it takes longer than it used to come to you. You lose your train of thought in the middle of a conversation. Or you wake up in the morning feeling as though your brain simply isn't fully switched on. And many older adults tell themselves the same thing. I'm getting older. This must be normal. But sometimes it isn't. And one of the most important things I want you to understand today is that brain fog is not a medical diagnosis. It is a description of a symptom. That symptom can have many different causes. Poor sleep can do it. Certain medications can do it. Depression and anxiety can do it. Dehydration can contribute. Medical conditions can affect concentration.
Hearing problems can make your brain work harder to understand conversations. And sometimes there's a nutritional or metabolic problem that people don't think to check. One example is vitamin B12 deficiency. B12 is involved in normal nerve function and the production of healthy blood cells. When levels are too low, some people can develop fatigue, weakness, numbness, balance problems, or cognitive and neurological symptoms. And here's what makes this particularly important after 60. A person can have a B12 problem without immediately realizing what is happening. They may simply feel tired. They may feel mentally slower. They may blame their memory. They may blame retirement. They may blame age. But if the underlying problem is something that can be identified and treated, assuming it's simply aging could mean missing an opportunity. Stay with me because later I'll explain why B12 deficiency can be overlooked, which medications and medical conditions can increase the risk, what symptoms deserve attention, and what you should ask your doctor before assuming your brain fog is just part of getting older. I'm a doctor, and I've spent more than 35 years caring for adults as they get older. My goal is simple. I want to take medical information that can sound complicated and explain it the same way I would explain it to someone sitting across from me in an examination room. And today, we're talking about something I hear frequently. Doctor, I don't feel like my brain is working the way it used to. That sentence deserves attention, not panic, attention. Let me tell you about someone I'll call John. John was 71 and lived in Arizona. He had retired after working for many years as a maintenance supervisor. He was the kind of person who could remember where every tool in his garage belonged. He could look at a machine and often figure out what was wrong with it before anyone else. After retirement, he spent time repairing things around the house, walking in the mornings, and helping his grandchildren with small projects. Then his family noticed a change. John started forgetting simple words. Not every word. Just occasionally. He would say, "Hand me that thing," even though he knew exactly what he wanted. His wife noticed he was asking the same question more than once. He also began taking afternoon naps. John wasn't especially worried. He said, "I'm 71. Of course I'm slowing down." But eventually, he noticed something himself. He couldn't concentrate on the newspaper. He would read a few paragraphs and realize he couldn't remember what he had just read. That frightened him. His biggest fear wasn't getting older, it was dementia. When he came in for an evaluation, we didn't assume that was the explanation. We started with his medical history, his sleep, his medications, his diet, his mood, his neurological symptoms, and his blood tests. One of the things we found was that his vitamin B12 level was low. That didn't automatically explain every symptom, and it certainly didn't mean we had found a magic answer, but it gave us an important piece of the puzzle. And this is the first lesson I want you to remember. When an older adult develops brain fog, don't jump immediately to the most frightening explanation. Look for the reversible possibilities first. The brain is not isolated from the rest of the body. It depends on oxygen, blood flow, nutrients, hormones, sleep, metabolic balance, and healthy nerve function. If one of those systems becomes disrupted, your thinking can be affected. Now let's talk about vitamin B12.
Your body uses vitamin B12 for several important functions. It is involved in DNA production, red blood cell formation, and normal neurological function.
One of its roles is helping maintain myelin, the protective covering around many nerves. Think of myelin like insulation around an electrical wire. When that insulation is healthy, signals can travel efficiently. When neurological function is affected by B12 deficiency, symptoms can include numbness, tingling, weakness, balance problems, fatigue, and cognitive changes. The National Institutes of Health notes that vitamin B12 deficiency can cause neurological changes and that these problems can occur even without obvious anemia. ods.od.nih.gov. That last part is important. Many people assume that if their blood count is normal, they couldn't possibly have a B12 problem. That's not necessarily true. Neurological symptoms can sometimes occur without the classic signs people expect, and that is one reason B12 deficiency can be overlooked. Now here's where things become especially important after 60. As we age, the way our bodies absorb certain nutrients can change. Vitamin B12 from food is attached to proteins. Your stomach produces acid and other substances that help release B12 from food so it can eventually be absorbed in the small intestine. If that process becomes less efficient, your B12 status can be affected. Some older adults also develop conditions that interfere with absorption, and certain medications can play a role. One medication category we need to discuss is proton pump inhibitors, commonly used for acid reflux. Another is metformin, which is commonly used to treat type 2 diabetes. The NIH notes that prolonged use of acid-suppressing medications and metformin can interfere with B12 absorption or status in some people. ods.od.nih.gov. Now, I am not telling you to stop either medication. Please don't do that. If your doctor prescribed a medication, don't discontinue it because of something you heard in a video. Instead, ask a better question. Does this medication affect my B12 level, and should mine be checked? That's a much more useful conversation. And this brings us to another important point. Brain fog isn't necessarily caused by one thing. Imagine your brain as a control room. You have dozens of systems feeding information into that room. Sleep is one, medication is another, mood is another, hearing is another, nutrition is another, blood flow is another. If several systems are slightly disrupted at the same time, you may notice a significant difference in how you feel. That is why a good medical evaluation doesn't simply look at memory, it looks at the whole person. Now let's talk about the first clue that might make you consider B12 deficiency. Persistent fatigue combined with mental slowing. Everyone gets tired. You may have stayed up late. You may have had a busy day. You may have slept poorly. That isn't unusual, but if you consistently feel exhausted and mentally slowed down, particularly if this is a change from your normal baseline, it deserves a conversation with your doctor. B12 deficiency can interfere with normal red blood cell production, and significant deficiency can contribute to anemia. Anemia can reduce the body's ability to deliver oxygen efficiently to tissues, potentially contributing to fatigue and weakness. But remember, fatigue has hundreds of possible causes: iron deficiency, thyroid problems, sleep apnea, depression, heart disease, kidney disease, medication effects, and many others. That's why fatigue alone doesn't point to B12. The clue is the combination of symptoms. And here's where many people overlook something important: neurological symptoms. Maybe your hands feel different. Maybe you notice tingling. Maybe your feet feel numb. Maybe your balance isn't as good. Maybe you feel unsteady when walking. Maybe you have a strange sensation in your legs. Those symptoms have many possible explanations, including nerve damage from diabetes, spinal problems, circulation issues, medication effects, and neurological disorders. But B12 deficiency is another possibility. The NIH specifically notes that B12 deficiency can cause numbness, tingling, difficulty walking, confusion, and cognitive impairment.
ods.od.nih.gov. This is one reason I don't want anyone to look at brain fog as purely a brain problem. Sometimes the clue is in the hands or feet. Now, let's return to John. When I asked him about his symptoms, he initially didn't mention the tingling in his feet. He thought it was unrelated. Then his wife reminded him, "You've been complaining about your feet for months." That changed the conversation. John had been focusing entirely on his memory, but his symptoms were broader: fatigue, mental fog, tingling, and changes in concentration. That doesn't prove B12 deficiency,
But it made checking his nutritional status reasonable. And this is the second lesson. Don't just tell your doctor, "My memory is worse." Tell them everything that changed: your energy, your sleep, your balance, your sensation, your appetite, your medications, your mood. Those details can help your doctor see the pattern. Now, there is another group of people who deserve special attention: people who eat very little animal-based food. Vitamin B12 is naturally present in foods such as meat, poultry, fish, eggs, and dairy products, while many plant-based foods contain B12 only when they have been fortified. ods.od.nih.gov. That doesn't mean you need to eat meat. It means that if your diet contains very little B12, you need to make sure you're getting adequate amounts from fortified foods or supplements when appropriate. Older adults may also have absorption problems even when their diet contains B12, so diet alone doesn't tell the whole story.
Now here's something else that surprises people. You don't necessarily need to have severe symptoms before it's worth discussing the possibility of deficiency. The earlier the cause is identified, the better, particularly when neurological symptoms are present. The NIH notes that neurological damage from prolonged B12 deficiency can become serious, and some neurological problems may not completely reverse if deficiency is left untreated for a long time. ods.od.nih.gov. That's why I don't recommend waiting months or years while assuming your symptoms are simply aging. Now let's talk about another source of brain fog: sleep. This is incredibly common. If you are sleeping poorly, your brain may not perform at its best during the day. You may feel mentally slow. You may struggle with attention. You may become irritable. You may forget information because you weren't fully attentive when you first heard it. And sleep apnea deserves special attention. If you snore loudly, stop breathing during sleep, wake gasping, or experience significant daytime sleepiness, talk with your healthcare professional. The brain depends on stable sleep and adequate oxygenation, so if your brain fog is accompanied by major sleep problems, don't overlook that connection. The next point is medications. Older adults often take multiple medications. Some medications can cause drowsiness. Some can affect attention. Some can contribute to confusion. Some can interfere with nutrient absorption, and combinations of medications can sometimes have effects that aren't obvious when you look at each medication separately. That's why I encourage adults over 60 to periodically ask for a medication review. Bring everything: prescription drugs, over-the-counter products, vitamins, supplements, sleep aids, pain medications, antacids, everything. Don't assume something is harmless simply because you bought it without a prescription. And don't assume something is causing your symptoms simply because you read about it online. Ask your doctor or pharmacist. Now let's discuss another overlooked possibility: thyroid problems. Your thyroid helps regulate metabolism. When thyroid function is abnormal, people can experience fatigue, difficulty concentrating, mood changes, and other symptoms. Again, brain fog is not specific to B12. It can be part of many different medical conditions. That is why testing is important when symptoms persist. The same is true for depression. Depression in an older adult may not always look like sadness. It can look like low energy, loss of motivation, difficulty concentrating, sleeping too much or too little, loss of interest in hobbies, A person may say, "My memory is getting worse," when part of the problem is actually that they are mentally exhausted or unable to concentrate. This is why I ask patients about mood, even when they come in complaining about memory.
The brain and emotions are connected. Now, let's talk about hydration. Older adults may sometimes drink less because they don't want to get up frequently during the night. They may also have a reduced sense of thirst. Dehydration can contribute to weakness, dizziness, fatigue, and confusion. But I want to be careful here. There is no universal amount of water everyone should drink. People with heart failure, kidney disease, or other conditions may have specific fluid recommendations. So don't force large amounts of fluid simply because someone online says you need a certain number of glasses. Ask your healthcare professional what is appropriate for you. The important point is that brain fog is often multifactorial, and that's why chasing one miracle solution isn't good medicine. Now, I want to talk about what you can do. Step 1 is to identify the pattern. Write down when the brain fog occurs. Is it every morning? After lunch? After taking a certain medication? After poor sleep? All day? Does it come and go? Has it been present for weeks? Has it been getting worse? Those details matter. Step 2 is to review your medications. Ask your doctor or pharmacist whether any of your medications could contribute to fatigue, confusion, sleepiness, or changes in concentration. Ask specifically about long-term use of acid-suppressing medications or metformin if you take them, and whether B12 monitoring is appropriate. Again, don't stop anything on your own. Step 3 is to ask whether B12 testing makes sense. Your doctor may decide to check serum B12. Depending on the situation, additional testing such as methylmalonic acid may sometimes help clarify whether a functional B12 deficiency is present, particularly when the B12 level is borderline. ods.od.nih.gov. Your doctor will decide which tests are appropriate based on your symptoms and medical history. Step 4 is to review the rest of the picture. Ask about thyroid function, blood counts, kidney function, sleep, mood, nutrition, hearing, and other conditions that could affect cognition. Step 5 is to look at your diet. Make sure you're getting adequate nutrition. If you eat animal products, foods such as fish, poultry, meat, eggs, and dairy provide B12. If you follow a vegetarian or vegan diet, fortified foods or supplements may be necessary depending on your individual needs. ods.od.nih.gov. But don't assume that taking more is always better. Vitamin supplements are not a substitute for understanding why your level is low. Step 6 is to address sleep. If you're snoring loudly, waking frequently, gasping during sleep, or excessively sleepy during the day, ask whether a sleep evaluation is appropriate. Step 7 is to keep your brain and body active. Walk if you're able. Maintain social connections. Read, learn, have conversations, work on hobbies. Stay physically active within your abilities. These activities are not a cure for dementia, but they support overall health and help maintain function. And perhaps most importantly, Step 8 is to stop blaming every symptom on age. Getting older can change how quickly you process information, but persistent or worsening brain fog deserves attention. If you're finding this helpful, let me know in the comments, and tell me where you're watching from. Now, I want to make something very clear. A B12 deficiency is not the hidden explanation for every case of brain fog. It isn't. And I don't want you leaving this video thinking that one vitamin will prevent dementia. There is no responsible medical basis for making that promise. If your B12 level is normal, taking extra B12 isn't likely to magically sharpen your memory. And if your brain fog is caused by sleep apnea, depression, medication effects, thyroid disease, or another condition, treating B12 won't solve the underlying problem. The value of checking B12 is that deficiency is identifiable and treatable. That's very different from claiming that B12 is a miracle brain supplement. Now let's talk about John one more time. After his evaluation, his doctors addressed his B12 deficiency and continued investigating his other symptoms. His family noticed that some of his fatigue improved. His neurological symptoms also needed continued monitoring. But his story wasn't about discovering one magical vitamin. It was about not assuming that every change was dementia. That distinction gave him something incredibly valuable: an explanation to investigate. And that's what I want you to take away. When you notice brain fog after 60, don't immediately ask, "Do I have dementia?" Start with a better question. What changed? Maybe you're sleeping poorly. Maybe your medications need review. Maybe your mood has changed. Maybe your thyroid needs evaluation. Maybe you're not getting adequate nutrition. Maybe B12 is low. Maybe something else is going on. The only responsible way to know is to evaluate the whole picture. And there is one situation where you shouldn't wait for a routine appointment. If confusion develops suddenly, especially with weakness on one side, facial drooping, trouble speaking, sudden severe headache, major vision changes, or difficulty walking, seek emergency medical attention immediately. Sudden neurological changes can be signs of a stroke or another urgent medical condition. But gradual brain fog is different. It deserves a thoughtful evaluation, not panic. Now, if you are sitting there thinking, "I've been feeling this way for months," I want you to hear this clearly. You are not imagining your symptoms. But you also don't need to assume the worst. Write down what you're experiencing. Bring that information to your doctor. Bring your medication list. Tell them about your sleep. Tell them about your diet. Tell them about tingling or balance problems. Tell them about fatigue. Tell them when the symptoms began. And tell them whether they're getting worse. Those details can turn a vague complaint into a useful medical conversation. Your brain is part of your entire body. It depends on nutrition, sleep, blood flow, hormones, healthy nerves, and overall medical health. Sometimes the path toward better brain function begins somewhere you weren't expecting. Perhaps in your medication cabinet, perhaps in your sleep habits, perhaps in a blood test, perhaps in your thyroid, or perhaps in a nutrient your body isn't absorbing properly. That's why I don't want you to ignore persistent brain fog, and I don't want you to fear it either. I want you to investigate it. Because there is a big difference between assuming something is normal and actually finding out why it is happening. After more than 3 decades of caring for older adults, one lesson continues to stand out to me. Don't let the phrase, "I'm just getting older," end the conversation. Aging is real, but not every new symptom is caused by aging. Sometimes there is an explanation, and sometimes that explanation can be treated. If this video helped you understand brain fog a little differently, consider subscribing for more calm, evidence-based health information for adults over 50. And before you go, I want to ask you one question. When you experience brain fog, what do you notice most? Difficulty remembering names? Trouble concentrating? Fatigue? Word-finding problems? Or feeling mentally slow? Share your experience in the comments. You may help another person realize that they aren't alone and that it's worth talking with their doctor. Take care of yourself. Pay attention to changes. Ask questions. And remember, getting older doesn't mean you have to accept every new problem without understanding it. Sometimes the most important step toward protecting your brain is simply asking the right question.